Hello, everybody. How you guys doing? This is Agent Revan. Agent Revan. Now, I am like, well, here. Let me turn the light here. Wow, I mean, holy crap! I got done watching a Project Veritas video, and I tell you what, watching it kind of got me a little teed off here. Now, the CARES Act is a program being used to fund hospitals and shit like that and whatnot. And well, there's a hospital in Louisiana that is committing fraud by using COVID and shit like that. And there's this nurse who used to work at the hospital. It's a United Health, and she worked here for 7 years. Just quit, I guess. Either quit or got fired or whatever. But comes to terms that it seems that if you were in a car wreck or if you were shot multiple times, you were put under a code as having COVID-19. And the hospital is doing this for a financial incentive. More people who have COVID, more money coming in through the feds, federal CARES Act and shit. And I don't know. I mean, fraud is a crime. It is a crime. And you would be doing the Bernie Madoff sentence. Or if you're protected, you'll be a scapegoat taking your place. Now, I want to get to this thing here. This
I mean, yes, she had COVID.
Okay.
She tested positive for COVID, but that wasn't her reason for admission.
I would think that there's some motivation that it's driving higher rates of reimbursement or quicker reimbursement or something.
The guy went in for multiple gunshot wounds, and he was coded as COVID. I'm like, he would have never known he had COVID if he hadn't gotten.
Title of the video was DOH whistleblower says COVID inflate for profit. He went for gunshot wounds and was coded as COVID.
Gunshot wounds. COVID it's interesting. It's the elephant in the room that you're not allowed to talk about. COVID is never going to end if we don't start calling this out.
COVID cases inflate for profit.
Tell us your name, your title, where you work.
My name is Jean Stagg. I am a nurse was a nurse with United Healthcare, Community and State Plan of Louisiana. Specifically, I do inpatient utilization management coordination.
And how long have you done that for?
I've worked for United about 7 years. About the last 2 years is when I've done the inpatient utilization specifically.
What brought you here today? Why come to Project Veritas?
Well, I've been seeing some cases come over.
Now, mind you, now listen to this.
that were coded as COVID-19 that I felt should not have been coded as COVID-19. I've tried to raise awareness to my leadership and even with the Fraud, Waste, and Abuse Department, and it just kind of fell on deaf ears. And I do have a few patients that, they went in for reasons outside of COVID symptoms, but they are still being counted on our census as a COVID admission. So that may be, showing some higher numbers as well.
Higher the numbers, the higher the reimbursement.
They did test positive for COVID, but they went in for other reasons, but they are still being counted in our numbers. So any questions?
Yeah, thank you so much, John. That was great.
Well, that's odd. You identified
It is odd.
if there were
Very, very
problems. And who are you speaking to there?
Well, this was our daily leadership call. So it's all of our leadership at the Louisiana Health Plan. And every Wednesday, I report off on our COVID inpatient numbers. You can see the trends. Obviously, we're concerned.
Now, the one thing is, for one thing, we're dealing with, on part of this COVID bullshit here, we got a guy who's been dealing with this disease crap for almost 40 years, Dr. Fauci, who got caught lying about the numbers and shit, about everything. Now, there's profit in this. There's profit in this COVID shit. And I don't know if this is the only hospital in Louisiana that's doing this, or there's a few hospitals that are involved in this. Because the CARE Act is, which get funding.
About when we see the spikes and the peaks. And so I try to explain why we're having peaks. It's not necessarily because we have patients that are critically ill with COVID. These are just the patients that are showing up on our daily census as a primary admitting diagnosis of COVID-19.
When did you first notice this trend of coding all new patients as COVID?
Some of them are legitimately COVID-19. But starting in around March of 2020, that's when I started really tracking and specifically focusing on just the COVID-19 patients. And I would say it's around June or July, I started seeing some cases which should not have been COVID, in my opinion.
We have an example here of, I believe, a gunshot patient. Does that ring a bell?
The one that really got me a while back, and I told Nicole, because I'm like, oh my God, this has nothing to do with COVID. The guy went in for multiple gunshot wounds, and he was coded.
Multiple gunshot wounds. And he was coded as COVID. I mean, you could have had a stroke, heart attack, gunshot wound, car accident, but yet you're put under the code as COVID, even though you ain't got COVID. This is fraud big time. Hugely. What the fuck going on, folks? This is fucking bullshit here, man. Holy fucking shit. Yeah, holy fucking shit, dude. What the fuck? There's people committing fraud using COVID, dude. Using COVID as a financial thing a tool, a crutch uses. We need reimbursement. Uncle Sam, we need reimbursement. Do they really need reimbursement, folks? I don't fucking think so. I don't fucking think so. Shit. I mean, if I look, I was never tested, but I got the shots. But yet, I'm still waiting for the booster. Okay, why is this hospital committing fraud by putting people who are on the code of COVID, even though there is no COVID involved? Gunshot wound, car accident, heart attack, stroke, diabetes, you name it, the whole fucking thing, folks, the whole goddamn thing here. Fraud is being fucking committed here, man. Like, holy fucking crap. And I tell you what, if this was caught, you know damn well the heads of the hospitals going down for it. But here's the question. Here's the $60,000 question. Is this the only hospital, or is there multiple hospitals with heads of those hospitals involved in frauding the government out of the CARE Act money by using COVID as the cash cow, the viral disease cash cow?
As COVID. I'm like, he would have never known he had COVID if he hadn't gotten gunshot wounds.
I mean, we take the cases as they're sent to us, but I've had a couple where it was like scheduled vaginal deliveries or car wrecks, you know, different things like that, that wasn't their reason for going to the hospital. But, you know, like I said, the only way they're going to show up on my census is if COVID is their primary diagnosis. I don't want to say it's fraud and abuse, but I mean, should I be reporting stuff like that or just letting it go?
It is. It's fraud and
I mean,
abuse.
the thing about it is we are finding, you know, people as we work them up who are COVID positive and they had no inclination to even know they might be positive. But, I mean, when I assess those folks and put in codes, that's never my number one code in that situation.
Who are you speaking to there?
That is Dr. Morial. She's actually my boss. She is the Chief Medical Officer for United Healthcare Louisiana Medicaid. But she also works as a hospitalist at a local hospital. So she's very familiar. She's been on the front line with the whole COVID.
And how would you characterize her reaction?
I think that she was a little bit surprised as well that her peers or the hospitals were doing that. You know, like she said, she wouldn't have done it in that way.
That's for that $2,100 fee for the windows for the antibodies. Are people being charged their deductibles for that, or is the feds just paying that outright?
The feds are paying for it at this point. But that may not be what's going to happen going forward. The feds are paying for it. But the supplies are somewhat limited.
When Dr. Morial
You hear that? The feds are going to flip the bill.
is referring to when the feds are paying for it, who is she talking about?
I would imagine that it has to do with the CARES Act and the federal funds that were allocated through the CARES Act.
Do you believe there's a
CARES
financial
Act.
incentive to do this?
I think that there probably is. So I don't see the actual financial side of it, but I have heard rumors, you know, that they are getting money directly from the federal government for COVID positive admissions.
And I'm wondering what the motivation would be for that, because I don't think the reimbursement is going to be any different.
Well, I know that the reimbursement turnover is quicker, right? Because with all of our COVID, it's like a 15-day
turnaround for reimbursement, whereas normally we're like a 30-day reimbursement. So,
Well, maybe that's driving some of the motivation.
and I thought that they got reimbursed at Medicare rate instead of Medicaid rate.
Imagine that shit. Imagine that. I mean, it does not sound good. It is not good at all. I think it's really fucked up that they're using the numbers to, I mean, the list of people, it could be 15 to 30, and the turnaround for reimbursement, again, it could be involved in a car accident, heart attack, stroke, gunshot wounds, you name the whole, the shit that has nothing to do with COVID is put under the code of COVID. This is bullshit.
They do.
I mean, Medicare rate would be significantly higher than Medicaid rate.
Yes. Yeah. I would think that there's some motivation that it's driving higher rates of reimbursement or quicker reimbursement or something. Because otherwise there's no reason to put, something like that as a leading diagnosis.
This is Dr. Morial, Chief Medical Officer at University Healthcare Medicaid in Louisiana.
And basically asymptomatic patients.
So typically when a patient goes into the hospital, they go through utilization review. So we have a team of nurses that review the patient's stay. We use a standard set of criteria. All hospitals, all insurance companies use the same set of criteria. And we basically are reviewing it and saying the care that this patient is getting meets criteria. They still need to stay in the hospital. If they don't meet the criteria, we deny the stay. Or maybe they shouldn't have been admitted in the first place. We're going to deny that. What happens is LDH, which is the Louisiana Department of Health and Hospitals, they have suspended utilization review. So they're basically telling the insurance companies that they cannot do medical necessity review. We can't deny anything. When that happens, you can see on that chart the spikes in numbers. It kind of correlates when LDH suspends utilization review.
Now, your critics might say that you're just speculating, that you're just assuming, guessing. How will you react to those critics?
I would say LDH is definitely suspending utilization review. It's unprecedented for them to do this.
What are we looking at here?
This is actually a health plan advisory. They have amended it multiple times. And this is basically telling them that all utilization management for all medical hospitalizations, including but not limited to initial service authorizations and concurrent reviews, must be suspended. Now, this is not specific to COVID-19. This is every single hospital admission. We're not allowed to do medical necessity review. So it gives the hospitals free rein to admit anything they want, code it however they want, keep the patients in the hospital as long as they want, and we're not going to deny anything.
Who is giving these directives?
This is coming from LDH, which is the Louisiana Department of Health and Hospitals. And I'll also point out, too, that LDH meets with all of the hospital heads, the CEO.
Wow. That is... That's sad. That is sad. You know, they can hold the patients for as long as they want. As long as they want. And fuck.
Of all of the hospitals, they meet once a week with the governor, and they discuss strategies and
with the governor
how they're going to go forward dealing with this COVID pandemic. COVID it's interesting because it's the elephant in the room that you're not allowed to talk about.
So what's your message to the doctors watching this feeling betrayed by you?
Well, I mean, I hope they live up to the oath they took to do no harm. To me, this is dishonest. I don't know that it's illegal because it's being allowed to happen by the CDC. I would hope that they would stand up to their hospital administration, because I'm sure they're getting pressure from their administration to test everyone, test them multiple times, get that COVID diagnosis on the chart. But I would hope that they would stand up. I mean, we have to stand up and fight this. COVID is never going to end if we don't start calling this out, what we see.
When I see a patient, and if the patient is presented with other symptoms that aren't suggestive of a COVID infection, even though they may test positive for COVID, that's not my primary diagnosis.
Wow. Holy shit. Man. Oh shit.
What's going on, Bay fam? It's your boy, Bay Area.
That is really fucked up. That is straight up fucked up, guys, man. I tell you, that is really, really fucked up. Definitely fucked up. Tell me your thoughts. Tell me your thoughts in the comments section. Please, if you're new to this channel, please leave a like, subscribe, comment below, hit the bell for notification. And if you got this transmission, you are the resistance. I'm Agent Ribbon. And this has been the Anonymous Republic Network. Please share this video. And live healthy, happy, and wise. I love you guys. And I'll see you all in the next video. Peace out. Godspeed.